I suggest that it's not something that you have to. I give an advice because here it's perfect. If I put more, she becomes fake, and I don't like fake girls. She has a lack of volume in the marinade, just a little bit of lack of projection in the chin, but just a little bit. If you wanna.
No, go. I know all my flaws, don't worry.
It's impossible just to lift a little bit the tip of the nose and to correct this. Yeah. But this I do it. Temple with Ellanse, you cannot use the bolus technique because with Ellanse maximum is 0.2. If you do the bolus technique with 0.2, first of all, I don't like the bolus technique in the temples because when you inject in the temples, also if you stay just above the crest, the most of the product stay in the muscle. Lift. If I show you my cadaver dissection, you see that the product is in the muscle. In the temples, you can move from here with the cannula, and you can just volumize very nice, just under the fascia. Because remember the anatomy, the frontal bone, the periosteum of the frontal bone, after the crest, remain in contact with the temporalis muscle. So the periosteum become the muscular aponeurosis of the temporalis muscle. Muscular aponeurosis of the temporalis muscle is the deep temporalis fascia. So if we touch the bone and we move the cannula close to the bones, we stay just over the deep temporalis fascia and under the superficial temporalis fascia. So it's a virtual space, very easy to inject and very safe because the arteries and nerves are above. If you want, I can show you one side of this technique because it's very nice. And to correct this. So if I can suggest a small correction here, just a small projection of the chin, but very, very, very small. And after we see here and the nose. Not so bad. Okay. Yeah, ciao baby. Where are my glasses? My bag with my glasses. Yeah. Love, only love. All we need is love. All you need is love. All you need is love. Love is all you need. Yeah. Think positive. Yeah, I'm okay. It was my knee. Okay. So painful. Okay. Have you got some cream?
Yes, I use.
We have to remove the cream because the skin is so creamy and we cannot mark on the creamy skin. All the patient, you must remove all the cream and the makeup. First of all, it's difficult to mark. Second, it's a source of infection. That is more important. A smoker. Cigar smoker. No, not cigarette. Yeah, it's vodka. It's a special brand for this workshop. No, not anymore now. Yoga soon. Okay, perfect. Okay. This is the temporal crest. No? When you touch, you feel when you pass from the temporal bone to the temporal fossa. Muscle, bone. I mark the border. This is the limit where we want to do the correction. Okay, here is where we want to improve the projection. If my entry point is here, when I touch the bone with the cannula and I move down, and in this case the cannula is 22, not 25, yeah, a bigger, because you need a little bit more rigid cannula to move. And you can inject Ellanse. Okay? I don't want to use a lot of products. I want to use a half a syringe here, one syringe here, and the rest of the nose. We will see. But here, technique is needle over the bone. 3 boluses, 0.2. 0.2, 0.2. It means that here I have 0.2, 0.2. Here you can use the needle, you can use the cannula because it's very small, so the needle is enough. Okay. Here you are in the level 2, so subcutaneous. Here you are superficial. Here you are close to the bone. Skin, fat, mentalis muscle, fat, bone. So we inject under the mentalis muscle, above it, close to the bone. Okay. The advantage is that if you do a bolus of Ellanse 0.2 here, and you, now she's alive, but if you have a cadaver, you inject, you open, and you see that the bolus is still there. Because Ellanse is a very strong G and E prime at the same time, so stay there. And the microsphere doesn't move. This is a great advantage when you have to work on the profile. Because really, I say it's a profiler in the sense that you just create a profile with this. Okay? I show you just the technique of the tempo. I leave the nose for me, the last. And here, you can enter from here with the needle. You have 0.2, so very easy. Needle deep on the bone. So I guided your hand here, and after I treat one side, okay, here is the crest. Feel it? Touch. Touch the crest. Okay. Yeah. Okay. Okay, here is the crest. Okay, I mark. Okay. I show you this side because it's more difficult, so the other side is easier. Okay, I changed. 22 cannula, perfect. And close. What's your name? Susan. Where are you from, Susan? Ah, another one, fantastic. Yeah, you are the third Irish patient in these days. No. Yeah, I love Irish. My best friend is married with an Irish lady, live in Dublin. Yeah. I was with them last week. I love Guinness. Disinfection. Can you breathe? No.
Do you want to knock me out first and be less painful?
Okay. Not really so painful, it's a little bit strange. Okay. I touch gently the bone. touch the bone. If you touch the bone and if you glide with the camera, okay. Here I am under the fascia. No. We touch the periosteum, but we move far from the bone and we stay over the temporalis muscle, under the temporalis, deep temporalis.
I think so.
No, over the deep temporalis fascia and under the. And that's it. With this technique is nice because you stay between the two fascia, but if you want, you can volumize also. The tail of the eyebrow. Okay. I remove it and little bit of franco massage. It is very useful because it's a little bit painful when you do it, but in 1 minute you're okay. What is the advantage? You are in a very safe plane. There is nothing. You can control the shape, because when you do the balls, you don't control the shape, you control only the volume. Here you control the volume and the shape. You can decide that you want more volume here, you put it. You need a little bit of volume here, you put it. You can. Yeah. For example, I work a lot in Asia. In Asia, we work a lot on the forehead. And you see? I want to do the other side. Maybe it's better if I. Sorry. Okay. Better. Yeah. Usually you survive to the first treatment, but no. This is typical because when you put pressure under the veins, you see a little bit more the veins for 2-3 days. It's not a complication. This is okay. This technique has been was the technique of Arthur Swift. Okay, with Voluma, just to say the name of the product. First of all, with Ellanse you cannot inject 0.5. If you follow the conference, you cannot, because 0.5 you have an nodule. I don't like. Because when you inject deep, yeah, you are deep on the periosteum, but you are inside the temporalis muscle. Go to a cadaver lab, inject in the cadaver, open, and you will see where is your filler. The filler is inside the muscle. Inside the muscle, it means that you massage, but you spread the filler in the muscle. How many times you use the temporalis muscle in your day? If you speak, you use it. If you eat, you use it. If you drink, you use it. So it means that your filler disappears. This is very good for the companies. They sell a lot of filler, but not for my patient. And it's painful because you inject inside the muscle. And when you use the muscle, you feel pain. I show you now with I always say I call the boys, the guys boys and the ladies babies, it's because I don't remember the name. So you are baby one today. So now baby one does the whole she touched, yes, she touched the bone, okay? If you touch the bone, when you enter with the cannula, you're just close to the bone, no? So, under your cannula, you have the periosteum and the bone. You move the cannula like this. The bone finish. You find the muscle. But the cannula cannot penetrate the muscle. So you stay, you slide not anymore over the bone, but you slide over the muscle. If you slide over the muscle, you have the deep temporalis fascia above, under you, and the superficial temporalis fascia over you. And you glide in a very simple way. The only problem of this technique is sometimes when you do the hole, you have a bleeding because you have full of vessels. Rise and finish. Now, I guide your hand just to let you feel the sensation. Okay. You feel the sensation that you're against the bone, no? Okay. No, don't do this. Just. Okay. You feel that you can enter, you glide. If you force, it means that you are too superficial. Glide and. Be careful, don't inject here. Here is forbidden. Try to inject more. Okay. Yeah, too close, please. Stay a little bit. Because, okay. If you inject too close, if I see all the cannula, it's not good. I want to see just a little bit to the cannula. Yeah, you can. Because Ellanse has a strong power. It's like if you work with a saw. Yeah. And depend could be here or a little bit more. Depend. Usually, I try to see where the veins are. Okay. You see that I enter a little bit more. I don't say like this because I rise. I touch and I glide. I touch and I glide. I touch. The movement. I show you the movement one time. This is like surgery. When you learn surgery, the surgeon show you the movement one time. The second time, you are out. It's very strong surgery for the learning curve is. Yeah. No. It's better to use it in the stride because, look, if I go straight, now I touch, so I have the resistance of the bone. You see that I push, but I don't change. It's the muscle that push my cannula in the right position, okay? Year 22. Just a little bit of Franco massage again. Okay, I don't put light inside. No, solid not at all. You don't dilute it. Why you have to dilute it? Did you hear what I said? Forget it. You don't put a volumizer in the neck. You want to have a lot of lump? Okay, but don't call me. Yeah, I use it for us. In the hands is fantastic.
She gives you some.
Yeah.
Madonna has.
No, in the hands is fantastic. I use it too for the labia majora. Yeah. I start with 101, only 101, and you wait 2 months. After you can put a little bit more. You stay deep, obviously. The same technique of the hyaluronic acid. The only difference is that you change the color. In the old women, sometimes they are a little bit brownish, no? They change the color of the skin. They become more pink.
It's enough color.
To start, yes. Yeah, but inside the same like hyaluronic acid from the television. And prison.
Yeah.
Better, no?
It's like
Yeah, these are areas where the result is very nice, but when we do with the treatment, it's a little bit painful. But it's just a few seconds and disappear. Okay, prepare with the needle now. No noodle, needle. Noodles. Who want to treat them? Okay, I show you one marionette, just one injection in the chin. So, I do one, you do two. I do one, you do one. A lot of marionettes. Have you been married? Okay. With different kind of violence. I was playing tennis with my wife and I had a strain in my butt. It's a kind of violence. A butter crash is not nice. Okay. Where is the danger here? Deep. So we stay in layer 2. Because the artery, the facial artery, is under the depressor angularis, so it's deep. Becomes superficial here. The vascular pericord is deep. So where are the vessels? Deep. So I stay superficial. If the vessels are superficial, I go deep. Not like the vessels. And just subcutaneous, 0.2. Enough. I don't want to overcorrect this because after I have the collagen stimulation too. And now I go to the bone. I gently touch the bone. You see my needle is straight. If you see that the needle is not straight, it means that you are against the bone in this painful. And I inject 0.2. Okay. You see that with point 2, the shape has changed. Marionette. Don't touch me. You have point 2, so very, very small injection. Okay. Okay, you see if you put your finger not in the marionette. Here, huh? Easier. If you want to correct the marionette, you don't inject in the line. You inject beyond the line. Not superficial. Be closer. The needle is not so long. No, superficial. No. You must be able to make the difference between superficial and deep. If you are not able, change job. I'm very straight about this. Because an injector at least must know exactly where you are. No. Not in the line. Second. If I say not in the line, it means not in the line. You see, I can lift, I can see, and I'm not in the line. Very important, eh? Listen and do what I say, okay? Change the position and come here. Take a look from this side, how much has changed the shape of the chin with just point 2. Huh? So now, I guide your... First of all, this is not the technique. This is the technique. The syringe, this is technique. This one, you cannot control the injection. You cannot control. It's like to write with the pen. When you write, you don't write like this. You write like this. If you paint like this. This is technique. And the technique is something, as you play tennis, as you ski, as you dive, you must do it in the right way. Okay, so take it. Okay. Now here, it's important to maintain the vector correct. You see, I injected here, so we inject very close. Okay, you feel the bone, okay, very softly. And now, you inject point 2. This is the technique, perfect. Okay, baby 2. Perfect. We remove it, and we do exactly the same on the other side. Okay, you feel it? Try, the direction of the syringe is important because it's the direction of the vector. Take it and inject. Okay. Why it's important the direction of the syringe? If my syringe is like this, my projection is like this. If my syringe is like this, projection is there. A Franco massage. Or baby massage, or boy massage. You have to look at the patient, you have to study the patient. Some patients need more projection in this way. So give me a syringe with a needle, but don't remove the cap. Okay. If I want a projection, like this, I have projection in this way. If I want to length, I have projection like this. If I want to wide a little bit, I move in this way. So in this case, the lens is not bad, and I don't want to improve this projection. So I choose just 1 and 2 just to improve the shape. If you improve the shape, you give traction to the marionette. So with just one syringe, you can harmonize all the area. But if I need it, for example, to improve also this and this, I add 0.2 and 0.2 with 2 different vectors, and okay, put the needle please. Not really perpendicular, but yeah. Yeah, this. Let me. Now the nose, I know, is a little bit, I have to lift your nose. To the bone. Point 2. Yeah, because I'm close to the bone. Here, I am between the 2 cartilage. Okay. Yeah, I know. This was painful. 0, 1. But you lift. Yeah. So now she relaxed just a second, and we correct the tip. Where is the danger here? I do a lot of surgical rhinoplasty, open and close. When you do the open, you cut here. And you see they are 2 very small arteries, but they are so small that you cannot enter inside, not with a needle of, sorry. Yeah. Yeah, no. When you, yeah, that's it. If I punch your nose. The real problem with the nose is here, because here are the 2 major arteries of the nose. So it's much more dangerous when you inject here than when you inject here. Here are the terminal branches. Terminal branches, you have a lot of interconnection. Yeah, but very prominent. How big? Less than a millimeter, much less. And the needle is 27. So. Okay, to treat this area, usually I use the candle. Okay. Yeah. Now I have to stay here just a second. I know you hate me now, but after when you see the results, you do. All the lady hate me after say, "Oh, thank you." I face so much pain, but thank you. So close your eyes just a little bit. You see, this is the space between the 2 bones of the 2 cartilage. Oh, sorry. Coming close to the cartilage. Yeah, you can say whatever you want. Very deep. I'm under this muscle of the nose. Yeah, you can say whatever you want.
Irish.
Yeah, be Irish. I'm Italian, so you can be Irish. And the needle now. Okay, with the needle, you see the. I use this flat, okay? I go flat to the bone. If you stay against the bone, you're flat. Okay, inject. After, you can use it also to improve or to correct surgical rhinoplasty. The advantage of Ellanse, you see here I made line, but it will not spread, stay there. If you do a line with HI filler, spread. This is why when you do the medical rhinoplasty, the rhino filler, you don't do you do small boluses because you just create volume. This is the difference between Ellanse as a volumizer and the other volumizer. HI filler, just you create a volume. You don't create a shape. Here you create a volume and a shape. It's the only one. Polylactic acid, you create a volume. You inject, it's like a souffle. Not in the oven. Here, what you see is what you get. If you check this nose after 2 months, you will have this result. If you check this nose after 6 months, you will have this result. I do a lot in Asia, and after 1 year, you still have the result. A little bit better now? Or,
Yes.
because they help, yeah. I tried, but I was not sure. Yeah. Because in the Asian or in the black, when the nose is more, I use a lot the cannula, and I create all the nose. Yeah.
Why do you prefer to go this way? Or?
No, this way because here it's difficult to.
But again, it's the blood flow.
Yeah.
It's more safer.
To do it here, but the hunter, yeah,
Sometimes go transfers.
is very, but it's very small, no? This is why if you keep the needle with the cut and you maintain against the bone, you are safe. Can we have a mirror? So you see why you were crying. Okay.